American healthcare killed my wife. I have the bills to prove it. $680,000. My wife died on November 14th, 2024. She was 38 years old. Her name was Emily. We'd been married for 12 years. We have 2 kids. Had 2 kids. Now I'm raising them alone. Emily didn't die from cancer. She didn't die from a car accident. She didn't die from some rare disease that nobody could treat. Emily died because American healthcare is designed to let people die if they can't afford to pay. And I have the bills to prove it. Right now, sitting on my kitchen table, I have $680,000 in medical bills. $680,000 for 9 months of treatment that didn't save my wife's life. I make $73,000 a year as a systems analyst. I had health insurance through my employer. Good insurance, they said. Blue Cross Blue Shield. At $480 per month in premiums. $6,000 deductible. You're covered, they told me. I wasn't covered. Emily wasn't covered. And now she's dead. Let me tell you exactly what happened, because this isn't just my story. This is happening to thousands of American families right now, and nobody wants to talk about it. How it started, March 2024. Emily started feeling tired, really tired. She'd come home from work at 3 p.m. and fall asleep on the couch. Sleep until 8 p.m. Wake up, eat dinner, go back to bed. She's a high school English teacher. She loves her job. She never naps. Something was wrong. She went to our primary care doctor. Dr. Patterson, he did blood work. Results came back abnormal, low red blood cell count. He said, probably anemia, take iron supplements. I'll come back in a month. Emily took the iron supplements, got worse, exhausted, pale, started losing weight. May 2024, back to Dr. Patterson. More blood work. He looked concerned this time. He said, I'm referring you to a hematologist. This might be serious. The hematologist appointment was scheduled for July 18th. 2.5 months away. I called the office. I said, my wife is really sick. Can we get in sooner? They said, July 18th is the earliest available appointment with Dr. Kim. You can see a different hematologist in September if you prefer. September was 4 months away. We took July 18th. The diagnosis. July 18th, 2024. Dr. Kim examined Emily, ordered more tests, bone marrow biopsy, CT scans, blood work. July 30th. Results came back. Acute myeloid leukemia. Stage 4, aggressive. Doctor. And Kim said, we need to start treatment immediately. This is very serious. Emily started crying. I held her hand. I asked, what are her chances? Dr. Kim said, with immediate aggressive treatment, 30 to 40% survival rate over 5 years, without treatment 6 months. We started treatment the next week. The bills begin August 5th, 2024, Emily's first chemotherapy session. She stayed in the hospital for 5 days. They pumped poison into her veins. She vomited for 3 days straight, lost 12 pounds. All her hair fell out in 1 week. 2 weeks later, the first bill arrived. Hospital stay, 5 days, $127,400 chemotherapy drugs, $43,200 lab work and tests, $8,900, doctor fees $6,200. Total $185,700 I called insurance. They said, you haven't met your deductible yet. You owe $6,000. After that, you pay 20% coinsurance. I did the math. 20% of $179,700 is $35,940. My total out of pocket for 1 round of chemo, $41,940. I opened a credit card, put it all on credit. What choice did I have? My wife was dying. The treatment continues. Emily needed 6 rounds of chemotherapy, August through January, every 3 weeks. Each round cost between $140,000 and $210,000. Insurance covered 80% after the deductible. I paid 20%. Round 1, I paid $41,940, round 2. I paid $38,200, round 3. I paid $33,800, round 4. I paid $44,600 round 5. I paid $39,100 round 6. I paid $42,800. Total out of pocket for chemotherapy, $240,440. I maxed out 7 credit cards. Took out a home equity loan for $85,000. Borrowed $30,000 from my parents. Borrowed $15,000 from Emily's parents. Emptied our savings. How cashed out my 401k and paid the penalties. I did whatever it took, because this was my wife, the mother of my children. You don't let someone you love die because you can't afford treatment. Except that's exactly what American healthcare makes you do. When the treatment stopped working, February 2025, Emily finished her 6th and final round of chemotherapy. She'd lost 47 pounds. Her immune system was destroyed. She couldn't walk upstairs without stopping to rest. But the cancer was supposed to be gone. That was the goal. 6 rounds of aggressive chemo. Kill the leukemia, give her a chance. Dr. Kim ordered new tests, bone marrow biopsy, blood work, CT scans. March 4th, 2025. Results came back. The leukemia was still there. The chemotherapy had slowed it down, but it hadn't killed it. Emily's cancer was resistant to the standard treatment. Hi, Dr. Kim said, there's an experimental drug. It's showing promising results for patients with resistant AML. It's called venetoclax combined with azacitidine. The clinical trials have a 58% response rate. I said, when can we start? Dr. Kim said, I need to submit it to your insurance for approval. The drug costs $24,000 per month. I'll submit the request today. The denial, March 11th, 2025. 1 week later, insurance response letter arrived. Claim denied. Reason: treatment is experimental and not medically necessary. Patient should continue with standard approved protocols. I read that line 5 times. Not medically necessary. My wife is dying and they're calling the treatment not medically necessary. I called the insurance company, spoke to a representative named Karen. I said, my wife has stage 4 leukemia. Standard treatment failed. This drug is her only chance. Karen said, I understand your frustration, sir, but the drug is not FDA approved for first-line resistant AML. It's considered experimental. We don't cover experimental treatments. I said, the clinical trials show 58% response rate. That's better than anything else available. Karen said, you can file an appeal. Here's the reference number. The appeal process. March 15th. I filed the appeal, submitted Dr. Kim's medical justification, research papers on the drug, clinical trial data, testimonials from other patients. April 2nd. Appeal denied. After review by our medical board, the decision stands. Treatment is experimental. Claim denied. I filed a second appeal, called every day, spoke to supervisors, threatened to sue, begged, pleaded. Emily was getting worse. Though she was sleeping 18 hours a day now, bruises appearing on her arms from low platelet count, nosebleeds that wouldn't stop. April 28th, second appeal denied. Dr. Kim said, I'm sorry, without insurance coverage, the drug costs $24,000 per month. Most patients need it for 6 to 12 months. That's $144,000 to $288,000 out of pocket. I'd already maxed out every credit card. Already borrowed from everyone I knew. I had nothing left. I said, what if I pay cash? Can I set up a payment plan? The hospital billing department said, we require 50% upfront. That's $72,000. Then monthly payments of $24,000. I didn't have $72,000. I didn't have $7,200. I had $840 in my checking account. Emily didn't get the experimental drug. The final weeks, May 2025. Emily was too weak to get out of bed. The cancer was spreading. Her organs were starting to fail. On May 20th, Dr. Kim said, her kidneys are shutting down. We need to admit her to the hospital. Emily spent her last 3 weeks in the ICU hooked up to machines. Dialysis, oxygen, IV fluids, morphine for the pain. I sat next to her bed every day, held her hand. Our kids came after school. They didn't understand why mommy wasn't getting better. June 8th, Emily went into a coma. June 11th, Her heart stopped. They tried to resuscitate her. It didn't work. June 11th, 2024, 2:47 p.m. Emily died. The nurses were kind. They gave me time alone with her body. I sat there for 2 hours, just holding her hand, crying. Our kids were 9 and 6 years old. How do you tell a 6-year-old that mommy is never coming home? The bills after death. 2 weeks after Emily's funeral, the hospital bills started arriving. The ICU stay, 23 days, $487,000. Dialysis, $38,400. Doctor fees, $22,100. Medications, $19,800. Resuscitation attempt, $8,200. Total for final 3 weeks, $575,500. Insurance covered 80% after deductible. I owe 20%. My share, $115,100. Add that to the $240,440 I already owed from chemotherapy, plus the experimental drug we never got, plus all the other treatments. Total medical debt, $680,000, $680,000 for treatment that didn't save her life, for a drug we were denied that might have saved her life, for a system that let my wife die because we couldn't afford to pay. Emily is dead. I'm $680,000 in debt, and I'm raising 2 kids alone. This is American healthcare. Life after death. It's been 4 months since Emily died. I'm writing this from our kitchen table. The same table where the medical bills are stacked in 3 piles. Pile 1, bills I'm trying to pay. Monthly payment plans. $200 here, $150 there, barely making a dent. Pile 2, bills and collections. Debt collectors calling every day, threatening lawsuits, threatening wage garnishment. Pile 3, bills I've given up on. The $487,000 ICU bill. The $127,400 first hospital stay. I can't pay these. I'll never be able to pay these. My kids ask me why I'm always on the phone arguing with people, why I look tired all the time, why we can't go to McDonald's anymore. I don't tell them it's because their mom's death care costs more than I'll earn in 10 years. The bankruptcy decision. Last week I met with a bankruptcy attorney. Her name is Lisa Chen. She's seen cases like mine before. I showed her the bills, all $680,000. And she didn't even look surprised. She said, medical debt is the #1 cause of bankruptcy in America. You're not alone. I file 15 to 20 medical bankruptcies every month. I said, will bankruptcy clear all of this? She said, most of it. The medical bills, yes. But you'll lose your credit. Can't get a loan for 7 to 10 years. Can't buy a house. Can't get good interest rates on anything. Your financial life is basically destroyed. I asked, what if I try to pay it? She laughed. Not mean, just sad. She said, on your salary, you'd need to pay $3,000 per month for 18 years. Can you afford that? I can't. After mortgage, utilities, groceries, and childcare for 2 kids, I have maybe $400 left each month, not $3,000. I'm filing for bankruptcy next week. Emily died, and now I'm declaring financial ruin. Because that's what American healthcare does to families. I'm not alone. After Emily died, I started researching. I needed to know, is this normal? Do other people go through this? The statistics made me sick. 530,000 American families file for bankruptcy due to medical debt every year. That's 1,452 families per day, every single day. 66.5% of all bankruptcies in America are caused by medical bills. Not credit cards, not mortgages, medical bills. 45,000 Americans die every year because they can't afford healthcare. They delay treatment. They skip medications. They avoid doctors because they can't afford the bills. And they die. Emily is one of 45,000. One of 45,000 people who died because American healthcare is designed to profit, not to heal. Why this happens? Insurance companies are for-profit corporations. Their job isn't to keep you healthy. Their job is to make money for shareholders. The way they make money? Deny claims, delay treatment, make the process so complicated that people give up. That experimental drug Emily needed? It cost $24,000 per month. Insurance denied it because approving it would hurt their profit margin. They did a calculation. They decided Emily's life was worth less than $288,000 to their bottom line. And she died. This isn't a bug in the system. This is the system working exactly as designed. American healthcare spending, $4.5 trillion per year, highest in the world. We spend more than any other country on healthcare, but we rank 46th in life expectancy. 46th. Behind Costa Rica, behind Cuba, behind Slovenia, we pay the most and get the worst outcomes. Because the system is designed to extract profit or not save lives. What I want you to know: if you have health insurance, you think you're protected. You're not. I had good insurance. Blue Cross Blue Shield. $480 per month. $6,000 deductible. Emily still died. I'm still $680,000 in debt. Your insurance will do the same thing to you when you get really sick. When treatment gets expensive, they'll find a reason to deny coverage. Experimental. Not medically necessary. Out of network. They have 1,000 ways to say no, and you'll be left with a choice. Watch your loved one die, or go into life-destroying debt trying to save them. The final message. Emily was 38 years old, a high school English teacher, a mother, a wife, a daughter, a friend. She died because she couldn't afford a drug that might have saved her life. I'm $680,000 in debt, filing bankruptcy, raising 2 kids alone. This is American healthcare, not for the rich, not for the poor on Medicaid, for the middle class. For people like us who thought we were doing everything right. We had jobs, we had insurance, we paid our premiums. And it didn't matter. Emily is dead. I'm financially destroyed. And somewhere, an insurance company executive got a bonus for denying her claim. This is murder by spreadsheet, and it's happening to 1,452 families today, tomorrow, every day. My wife's name was Emily. She was 38, and American healthcare killed her. I have the bills to prove it.